After months of getting shots in arms across the country, a CBC News analysis shows those efforts are starting to pay off. During the second wave, the rate of COVID-19 cases among the oldest seniors and youngest adults was roughly the same. But as more people over 80 got the shot, cases dropped sharply among that age group, even as those among younger Canadians started to spike in the third wave. High rates of vaccination among long-term care residents had an even more noticeable effect, with deaths in that group plummeting.
It is good news that these vaccines work, and they're protecting some of the more vulnerable people throughout this pandemic.
But medical experts say the next group of vaccine recipients needs to be just as targeted as the third wave rages.
If we want to ramp down the cases, we really have to ramp up the vaccination in the younger groups. And in particular, vaccination in hotspots is a priority.
All set? There you go.
One of those hotspots is here in northwest Toronto, where everyone over 18 is allowed to get vaccinated. At this apartment complex, a local vaccination team is going door to door.
When we can create the biggest difference by doing mobile clinics where we have the greatest rates of COVID, I think we're finally getting to the root source of things.
A few blocks away, young adults wait in line at a pop-up vaccination site, including 21-year-old Angel Ofbara, who just recovered from COVID-19 herself.
I hope we can return to a sense of normalcy, I would say, after a while.
Or fairly soon. If at least 3/4 of Canadians get their first shot in the next few months, lockdown restrictions in hard-hit regions could be lifted over the summer, says Canada's Chief Public Health Officer.
But even then, you have to be cautious.
Cautious, but shot by shot, more hopeful. Lauren Pelly, CBC News, Toronto.